you take 2 pills for your back pain. 4 hours later, 2 more for that headache. Before bed, maybe 2 more because your knee's acting up. That's not abuse. That's a normal day for millions of adults over 45. Stop right now and listen. Because that painkiller sitting in your medicine cabinet, the one you think is harmless because it's over the counter, is quietly shutting down your kidneys. No warning, no pain, no symptoms you'd recognize. Just silent damage that by the time a doctor catches it, can't be reversed. This isn't happening to drug addicts. This isn't happening to people who overdose. This is happening to normal adults who take 2 pills for a backache, 2 more 3 days later for their knee, 2 more at the end of the week because they couldn't sleep. You're not abusing anything. You're managing pain like a responsible adult. And that's exactly why millions of people over 45 are losing kidney function right now without knowing it. Here's what makes this terrifying. Ibuprofen doesn't fail loudly. It fails silently. You don't feel your kidneys struggling. You feel relief. And that relief is why you keep taking it, week after week, month after month, year after year, until one routine blood test changes everything. Let me show you the math that doctors see every single day. 3 times a week doesn't sound like much, right? 3 times a week is 150 times a year. That's 150 times your kidneys have to deal with reduced blood flow. 150 times the filtering units in your kidneys are working under stress. And here's the part that makes it worse after 45. Before 40, your kidneys bounce back. The damage repairs itself overnight. After 45, they don't recover the same way anymore. Every year after 45, you lose about 1% of your kidney function naturally, just from aging. By 60, you've got 30% fewer working parts than you did at 40. So when you add ibuprofen on top of that 3 times a week, every week, you're not giving already struggling organs a break. You're asking them to work harder with fewer resources. Over and over and over, the tissue starts to scar. And scarred kidney tissue is permanent. Doctors have a name for this: analgesic nephropathy, painkiller-induced kidney disease. And the patients who get diagnosed with it say the exact same thing every single time. But I only took it a few times a week. That sentence shows up in kidney clinics every day. Here's what makes ibuprofen so dangerous. It blocks pain. But pain is your body's alarm system. So while damage is happening, you feel better. You walk more, you push harder, you delay rest, which means the thing causing the pain, whatever it is, gets worse. So you take another pill. And the cycle tightens. The pain you're managing today is setting up bigger problems tomorrow. And the solution you're using is quietly destroying the organs you need to survive. By the time most people find out, they've already lost 40 or 50% of their kidney function. And once it's gone, it doesn't come back. Kidneys don't regenerate like your liver does. They don't heal like skin does. They just stop working, slowly, quietly. Until you're looking at dialysis 3 times a week, year after year. How do you know if it's already started? There are signs your body sends. Most people miss them because they seem unrelated. Foamy urine that doesn't go away. That's protein leaking through damaged filters. Ankles that swell by the end of the day. Your kidneys aren't clearing fluid properly anymore. Exhaustion that sleep doesn't fix. Damaged kidneys don't produce enough of the hormone that makes red blood cells. Less oxygen gets to your tissues. Waking up multiple times a night to pee. Or the opposite, barely peeing at all even though you're drinking water. Blood pressure that used to be manageable suddenly isn't. A metallic taste in your mouth that won't go away? That's waste building up in your blood because your kidneys aren't filtering it out. If you're experiencing any of these, and you take ibuprofen regularly, more than twice a week, you need a kidney function test this week. Not next month, this week. Simple blood test, takes 5 minutes. It measures creatinine and something called eGFR. Don't ignore this. Early kidney disease you can slow down. Advanced kidney disease you can only manage. So what do? Just live in pain? No. But you need to stop asking your kidneys to pay the price for temporary relief. And there's one solution that works for joint and muscle pain without putting any stress on your kidneys at all. Topical anti-inflammatory relief. Not pills you swallow, not chemicals your kidneys have to filter. Applied directly to the area that hurts. Here's why this matters. When you take ibuprofen as a pill, it goes everywhere. Your whole body gets the drug, including organs that don't need it, including your kidneys, which have to work overtime to clear it out. Topical relief works locally. It reduces inflammation right where the pain actually is. Almost none of it enters your bloodstream. Your kidneys barely know it exists. Same relief, zero kidney involvement. I'm talking about creams with actual anti-inflammatory compounds, not the icy hot garbage that just creates a burning sensation to distract you. Real options. Capsaicin cream at 0.075% concentration. Diclofenac gel, which is the topical version of a prescription NSAID, but available over the counter now. Arnica gel for acute injuries. You apply it 3 times a day to the painful area. Most people feel significant relief within 48 hours. And your kidneys? They're not involved at all. This isn't slower. This isn't weaker. Studies show topical NSAIDs work just as well as oral ones for joint pain, with a fraction of the systemic risk. But nobody talks about this because pills are easier to market. Pills feel like they're doing more because you swallow something. But easier and feels like it's working aren't the same as safe for your organs, especially after 45. I know what you're thinking, but pills work faster. Yeah, they also work everywhere, including places that don't need it. Fast relief is not the same as smart relief. When you're 25, your body can handle the systemic hit. Your kidneys recover overnight. Your liver clears it efficiently. When you're 45, 50, 55, your body doesn't have that resilience anymore. Every shortcut you take with a pill is a withdrawal from an account that's already running low. You can keep making withdrawals, but eventually, the account runs out. And when it does, you don't get to open a new one. Here's the rule that kidney specialists use, but most people never hear. If you need ibuprofen more than 3 times a week, you shouldn't be taking it at all. You should be changing the method, not increasing the dose, not accepting it as normal. Because frequent pain isn't normal. It's your body telling you something needs to be addressed. Ibuprofen just turns down the volume on that signal. It doesn't fix anything. So you're left with ongoing damage to whatever's causing the pain, plus new damage to your kidneys from the pills. That's not pain management. That's just creating a second problem to mask the first one. If your doctor specifically prescribed ibuprofen for a condition, don't just stop taking it because some video told you to. But do have a conversation. Tell them you're concerned about kidney function long term. Ask if there's a topical option that would work instead. Ask if physical therapy or addressing the root cause makes more sense than ongoing pills. Most doctors will work with you on this. The problem is most patients never ask. They assume the first prescription is the only option. It's not. But if you've just been taking over-the-counter ibuprofen on your own, for everyday aches, for headaches, for joint pain, yeah, you should stop. Switch to topical. Give it 2 weeks. See if it handles your pain without making your kidneys pay the price. Here's what you're doing this week. If you take ibuprofen more than twice a week, stop. Today, get topical anti-inflammatory cream, capsaicin or diclofenac gel. Apply it 3 times daily to wherever hurts. And if you've been taking ibuprofen regularly for months or years, schedule a kidney function test. Know where you stand. Then come back here in 2 weeks and comment with your results. Did the topical option work? Did you avoid the pills? Your comment might be what convinces someone else to make the switch before they do permanent damage. If this video just saved your kidneys, hit the like button. YouTube will show it to more people who need to hear this before it's too late. Subscribe for health strategies for people over 45 that don't ask you to sacrifice one part of your body to fix another. Pain is temporary. Kidney damage is permanent. Choose accordingly.